If there are any questions for our two most recent panelists, that would be great. For Dr. Roth, I would start out with a question. What about patients with bladder augmentation? Do you feel they need to have specific restrictions from participating in any sports?
I instill in my bladder augment patients that it is absolutely mandatory that you need to empty your bladder before you go out and do a specific activity. I think that's the single most protective thing you can do. And realistically, when we have seen bladder augment ruptures, people who are reliable about emptying before participating in things with potential risks, I personally have not had a patient rupture if they're good about emptying before they participate. I will say that, like with anything, I think that it is really not necessarily my determination as a surgeon or as a physician that matters. It's about having a shared conversation with the family about what are the realistic risks for you specifically, given everything we know about your medical condition specific to you. And then I try to arm patients and parents with the information they need to make a good informed decision about what's the right decision for them. Because I don't think, it's not my life. So at the end of the day, I want to inform and help make an educated decision, but it's not my decision to make.
Yeah, I have not had a specific bladder augment injury related to sports either in my career, and I have not limited the activities of any sports for children with augmentation as long as they catheterize before they play. They have played football and hockey and the entire spectrum of sports, and so everybody counsels their patients differently, and every parent has a different level of risk aversion. So some of this is a personal choice too that you have to be comfortable with, but so many sports, have equal risks of injury in other ways too. You might break your bone, you might have a concussion, Things happen in sports and things happen in life. You might have an injury crossing the street, but sometimes you have to cross the street just to see what's on the other side in life, and that's a risk we all take. And so maybe I sound cavalier at times, but I think participation in team sports and fitness is just so valuable to overall health and well-being, like Dr. Roth has eloquently conveyed. Did anybody in the back of the room, we'll take a question.
Yeah. So every spring, she would have a lot of troubles with incontinence. She would spend the whole summer riding her horse and doing things that were working on balance and strengthening and core muscles and all that stuff. And when she would come back in the fall, she was perfect. And so it took a few years of that annual cycle to sort of figure out what was going on.
So she was strengthening her pelvic muscles with horseback riding. They would weaken in the months she didn't ride a horse, and she would leak. Yeah, exactly. So in the front row.
Yeah, I just had a question. Some of the parents I've talked with have talked about using I don't know what to call it, but a protection for the abdomen when they're doing something like martial arts. Do you recommend that?
I'll leave that to Dr. Roth or Ted.
Hello?
Yep.
So as urologists, we take care of a lot of patients with one kidney, one testicle. And for me, I don't think there's any data to suggest that a cup is going to prevent a testicular rupture. I don't think that data is very well kind of studied, but I recommend it to my patients. And if you see these NFL players, they all wear, during warm-ups, their little pads. And I kind of do recommend some kind of padding if they're doing some type of contact sport. I don't think that's enough padding that's going to prevent them from participating competitively or compromise their performance. But I do recommend they wear some protective, like under gear.
I think it's also, I counsel people that it's a little bit sport specific. If you're playing a sport like hockey or football where there's a bunch of pads and it's part of the game to wear them, then if there's availability for an extra sort of lower abdominal pad or a flank pad to protect the GU organs, then it's really not unreasonable to consider it. If you're playing tennis or you're playing something where there isn't a lot of protective equipment involved, then that may not be a reasonable thing to do. And usually those sports are the ones that are going to have much lower risks associated with blunt injury.
But overall, most patients with exstrophy have good core muscle strength and an abdominal wall that's as strong as all others and as protective as any others to injury. If there's a kidney transplant, that might be a select circumstance where if you're playing a game that's got a missile involved, like a hardball or a racquetball, and you don't want to get drilled directly into your transplant, that can be beneficial for these. And the technology of these abdominal pads has improved so much too. I have no financial advantage, but Under Armour makes some amazing sports gear that is not too cumbersome and gives people, I think, a sense of reassurance more than anything that they're protecting their child. Okay.
I have a question for Dr. Lee. Dr. Lee, you mentioned that for colloquial patients, the difference between the goals of being dry and continence, and then the importance of thinking about timing of surgeries. I wonder if you could just elaborate a little bit about the different factors that should be considered when determining when surgery should be considered.
Thank you. It's a question that I think we as a group are constantly discussing. I think number one comes down to nutrition and growth. If the patients aren't growing, they're probably not going to heal well from a major abdominal surgery. A second part is that I talked about the two parts of the bowel and the second part of the bowel not being very well developed. Sometimes we can use that second part that's not well developed as augmentation portion for the bladder, and we like to save that portion until the patient's older, because when the patients are very young, that second portion usually serves some function in terms of absorbing nutrients. And then number three, essentially we have to close the bladder neck typically in these patients with cloacal exstrophy, and that is a huge cost. It's a huge risk because if the channel is not working well, the way to empty the bladder, then that's an emergency. And another portion is related to nutrition, is that if you introduce a bowel segment in contact with the urine at a really young age, it can lead to some complications. So, and another portion of it, I think, is also related to the reproductive organs. If we know that we're going to have to address that at some point, we like to consolidate major surgeries together. And that plays a role in our decision. Typically, we have 2 or 3 or 4 surgeons involved to discuss the best timing, because truly in cloacal exstrophy, every, I think, approach and surgical decision is unique. It's very unique.
So related to that, which was a great answer, by the way, and it is complicated. So to achieve continence in cloacal exstrophy is going to require a bladder augmentation to enlarge and enhance the bladder to achieve that capacity you need. Yet you have to balance removing a piece of the intestine with the nutritional goals that are difficult to achieve and often short bowel syndromes. Does the bowel lengthen with time, and does delaying the surgery for some kids with nutritional, on the margin of nutrition, does it benefit them to wait longer to achieve more bowel length for such a surgery? And does it matter if you're going to be able to use their hindgut or their small intestine for the surgery?
Of course. Yeah,
Great answer.
It definitely
Okay.
does.
Next question. No, I didn't mean to cut you off. I was just being
good
silly at the
question.
end of the day here. There was a question in there, sort of, but I framed it in a way. Were there any other questions for Dr. Roth or Dr. Back of the room?
Yes. Yes, definitely. I think for reproduction, the technology is so advanced at this point where I like to counsel our patients that you have a fertility risk that is equivalent to the general population, but there may be some barriers for you to achieve pregnancy naturally, and that's mostly due to the kind of specifics regarding ejaculation. That's kind of why, because there's retrograde ejaculation. That's very common in bladder atrophy boys. And then for the girls, I think it's very important when the time is right to involve the urologic surgeons in terms of if there is a pregnancy, to have some discussion with a maternal fetal medicine provider or OB, obstetrician, and the urologist in terms of the delivery plan, taking into consideration the prior surgeries that the pregnant patient has undergone.
Okay, so we are going to take a break now. Thank you to our last two presenters once again. And